Good morning, good afternoon. I'd like to welcome you to our talk, Optimizing Military Ambulatory Care Teams Using Nurse-Sensitive Indicators and Improving Military Lives. First, I'd like to thank the conference organizers for this wonderful opportunity to go virtual rather than cancel the conference altogether. And thank you as well for attending today's session. Oop, 1, 2, 4. So, for our study, we had a very robust team of scientists, informatics, and other help. I'd also like to acknowledge our funding agency, the Tri-Service Nursing Research Program. We also had several other people who were instrumental in making this team a success, who weren't actually on the team. You can see their names down at the bottom. So we have no conflicts to report, and this is our story, and we're sticking to it. It's ours and nobody else's. So again, we pilot tested 6 of the 14 nurse-sensitive indicators recommended in the AAACN report from 2016 regarding development and pilot testing of nurse-sensitive indicators. So these are your objectives if you decide to accept them. And we hope by the end you'll know that what are exactly nurse-sensitive indicators, how are they developed, and how do they actually add to your professional practice. So as you're looking through this slide, the history of using data in nursing medicine in particular goes back quite a ways. Nightingale, as we know, was the very first nurse to use data to improve care. Abner Flexner did about the same thing with medical education in the early 1900s. And each of these other people or entities listed on this slide made a significant contribution to elevating nursing practice and advocating for the use of data to elevate nurses practicing to the full extent of their game and being full partners in healthcare. So the military healthcare system was a directed report across all military facilities to checking specifically on how they did on access, quality, and outcomes. And one of the main purposes or outcomes of that was to encourage more use or generalized use of benchmarked indicators. And then high reliability organizations, many of you already are familiar with that, they have a preoccupation for failure. In other words, they are constantly vigilant, looking for opportunities to fail and taking action to mitigate before that failure occurs. So on this slide, it shows a little bit more in depth. So one of the structures available to military facilities is patient-centered military homes or medical homes. And in the middle column here is the scientific or literary evidence behind these models and professional nursing and nursing practice itself, all under the umbrella of high reliability organizations. So looking across, you can see the synergy of each and where everything fits together and enhances the practice of the other. This is just taking a little deeper dive, and we'll refer back to this slide multiple times. So you can see over here, there are many, many people in the outpatient side of the house that actually touches the patient. There's a whole team behind what the patient sees in the clinic. Again, the tenets of HRO, committed leadership, preoccupation with failure, being very mindful about what you do, and then your professional practice that for which everyone, nurses, LPNs, unlicensed assisted personnel, everyone has a lens from which they approach their patient care. So you may or may not realize that the American Academy of Ambulatory Care Nurses actually does have a professional practice model. It is in their standards and scope of practice. And you can see that the patient and the nurse are synergistically in the center of the model. So over that, we overlaid our military healthcare system. And you can see that there are just a few differences, not many, but there are a few important differences. So example, the nurses may be practicing in a base in a military clinic on land, just like you and I, or just like you, a military nurse, so sorry about that. Just similar to civilian clinics, they might be in an airplane, they might be on a ship somewhere, So in a tent in Afghanistan. So the area they practice, it still does not mean that they give less than stellar care. So regardless of where the military nurse is, they need to be following the tenets of HRO and their professional practice. So this slide just shows you what criteria must be met before an indicator is considered solid, scientifically grounded, and benchmarkable. So there has to be some evidence behind it. It has to address either the structure, process, or outcome of care. It has to be important to not only patient outcomes, but the organizational goals. And most importantly, it has to facilitate genuine quality improvement. So it can't just be something that someone wants, a pet project. It has to be benchmarked across multiple entities. Okay, so in looking at this definition of what exactly a nursing sensitive indicator is, and thinking about back to that slide of all of those people who impact care, finding out the specific elements of where nurses actually touch the patient and those elements that can be improved through evidence can sometimes be as hard as climbing a mountain. But once you get to the top of that journey, the view is awesome. And if you've ever been to the Seattle-Tacoma area, you have seen our huge extinct volcano. I hope it stays extinct. In basically our backyard. It dominates the landscape, but it is really awesome. And that's what nurse sensitive indicators can do for you and your practice, make you even more awesome than you already are. So here again is how these indicators are organized. They either impact a structure, so care delivery model, how you approach patient education, even what your mix looks like, right, in your clinic. Some military facilities, they have one RN across 2 or 3 smaller clinics, and then they're supported by a strong base of LPNs and medics or corpsmen or airmen. What processes, what you actually do, what the staff actually does to improve care, and then what the outcomes are, especially satisfaction and engagement of patients, right, and cost. So cost per value, or cost of care, the value of care, is also a major player in this. So looking at this slide, this star actually represents the Army's professional practice model for nurses. And you can see one of the stars, one of the limbs, is evidence-based practice. Again, if you are performing best practices, you have to be able to measure what you're doing and saying, yes, we are doing this because we have X, Y, and Z outcomes. So again, I hope by now you're already thinking that this isn't just another task in your day that you're going to be asked to do. It actually will enhance your practice and make you a better nurse. And I'm not talking just about RNs and LPNs as well, and all the support staff. It's a team effort. So a little bit about military health care, and down here at the bottom, I just want to draw your attention to, on the left side is the Air Force professional practice model, the Army you've seen on the previous slide, and then the Navy. So each service, each corps, has their own professional practice model, but based in the literature, the core concepts are the same. How it is operationalized might look a little different, but the concepts are the same. So military healthcare is expensive. It's a $50 billion per year industry, and 2/3 of that $50 billion is spent in the ambulatory care side of the house. So you are extremely important and germane to the care of our servicemen and women. We do have almost 10 million beneficiaries, and as you can see, the nurses are very, very busy. So there is a definite need for metrics that can show the value of the care and how well they do it. And if they're not doing a good job, or some process needs to be improved, we have to be able to measure that as well. So here's some resources when you're going looking for some indicators that you may or may not want to put in your clinic. So these are all the entities that, the major players, so to speak. So the National Quality Forum, some of you may have heard HEDIS measures, ANA, and of course the one we based our study on, the AAACN's industry report.